High blood pressure is not a disease. A normal BP reading should be within 120/80. If you are somebody that is having issues with high blood pressure, foods that are rich in potassium will actually lower the sodium level. Sodium is one of the minerals that increases the blood volume of the blood and thereby increasing the blood pressure. I will be discussing on how to use your NLS device to trace the root cause of high blood pressure with your patients. There are other home therapies that you can actually practice, like what I call onion therapy. We have the white onion ball and we have the purple onion ball. I'm talking about the purple onion ball. You see that outermost part that you usually throw away? It is high in quercetin. Wash it well with likes of apple cider vinegar, blend the whole bulb, take away the rough edges and drink the juice that comes out of it. That will crash high BP in the body within 3 to 5 days. For those of us, especially for men who have been taking synthetic medication for BP, you may get your BP lowered, but if you continue like this for years, the side effect is that it may land you in a case of erectile dysfunction. The main function of the parathyroid gland is to regulate calcium level in the blood. Now, a situation whereby one of the parathyroid gland develops a tumor, what will happen is it is going to cause an over-secretion of the parathyroid hormone. The parathyroid gland is the gland responsible for secreting the parathyroid hormone. And the parathyroid hormone plays an important role in regulating calcium level within the blood. If the calcium level within the blood is increased on account of a tumor in the parathyroid gland, it means there will be an overproduction of calcium within the bloodstream. So when there's an overproduction of parathyroid hormone, this excess parathyroid hormone, PTH, travels from the blood to the bones. And when it's to the bones, it will activate the osteoclast cells to come to play. In the bones, we have what we call bone remodeling. That is a breakdown and build-up of bones. Okay, that's a remodeling process that happens from time to time. Okay, and it comprises of the activities of the osteoblast cells and the osteoclast cells. The osteoblast cells are responsible for the building up of bones, and the osteoclast cells are responsible for the breakdown of bones. But in this situation, what happens is the osteoclast cells are activated to come to play, and they'll begin to break down the bones. When this breaking down of bones comes to play, calcium level increases in the blood. When this calcium levels increases in the blood, they begin to precipitate around the walls of the blood vessels, like the arteries, and this is what causes the arteries to get hardened. When they get hardened, they in turn will increase pressure of blood because it becomes less elastic, and because they become less elastic, then high blood pressure comes to play. If there's a malfunction in the kidney, if the kidney is not performing well, then the aldosterone level will always be higher than normal. What is the function of the aldosterone? The aldosterone is a hormone that is released to trigger reabsorption of sodium into the bloodstream. And anywhere sodium goes, water goes. When water follows sodium, the blood volume increases, thereby increasing the blood pressure. That is how the person begins to experience high blood pressure. I'm looking for arteriosclerosis. Can you see it here? Can you see it here? Arteriosclerosis, talking about hardening of the arteries. Okay, look at what I discussed about aldosterone level in the blood. Aldosterone level in the blood. Okay, if you remember what I said about how the adrenal gland will trigger the secretion of aldosterone in the blood, thereby increasing the sodium level, thereby increasing the blood level, thereby increasing the blood pressure level. There are other hormones, steroid hormones, that also regulate blood pressure. So if there's a malfunction, it may affect or it may lead to high blood pressure. When it comes to interpretation, you will need to subscribe for my NLS online masterclass course to be able to know how to interpret such results. Then I even mentioned practical home remedies that you can use to actually manage high blood pressure. Now, if you even want to know more on how to treat high blood pressure and say goodbye to it, then you need to also subscribe for my online masterclass course in natural medicine, where we have several lecturers that discuss nothing less than 10 different herbs, that's in different plants, that you can use to treat high blood pressure and say goodbye to it. Not just the plants, the how to prepare it, everything about the whole process, you will learn from it if you subscribe from my online masterclass course in natural medicine. If you want to subscribe from my online masterclass course in natural medicine, put it down in the comment section. I want to subscribe for the natural medicine online masterclass course. Then I will guide you on how to go about that. And if you want to subscribe for my NLS online masterclass course, type in the comment section, I want to subscribe, and I will guide you on how to go about that.